Congestive heart failure. Congestive heart failure is a condition in which the heart function has a falling inadequate to deliver oxygen-rich blood up to the body.
The left chamber of the heart, called the left ventricle, is the main pumping chamber. There are many different conditions that can lead to congestive heart failure, including a prior heart attack, high blood pressure, and coronary artery disease. Any of these can prevent the heart from efficiently pumping blood to the rest of the body. As a result, the heart may beat faster and the ventricle may increase in size, becoming an even less effective pump. When the kidneys sense the reduced blood flow, they attempt to compensate by retaining more water and salt. This excess fluid retention often causes congestion in the tissues and results in swelling and an increased strain on an already weak.
A healthy heart, as seen here, beats approximately 60 to 100 times a minute, providing oxygen-rich blood to the rest of the body. The lower left chamber of the heart, called the left ventricle, is the main pumping chamber. There are many different conditions that can lead to congestive heart failure, including a prior heart attack, high blood pressure, and coronary artery disease. Any of these can prevent the heart from efficiently pumping blood to the rest of the body. As a result, the heart may beat faster and the ventricle may increase in size, becoming an even less effective pump. When the kidneys sense the reduced blood flow, they attempt to compensate by retaining more water and salt. This excess fluid retention often causes congestion in the tissues and results in swelling and an increased strain on an already weak.
Congestive heart failure can be caused by the weakened heart muscles may not be able to supply enough blood to the kidneys, which then begin to lose their normal ability to excrete salt and water. The lungs may become congested with fluid, and the person's ability to exercise is decreased. Fluid may likewise accumulate in the liver, thereby impairing its ability to rid the body of toxins and produce essentially proteins. The intestines may become less efficient in absorbing nutrients and medicines. Fluid also may accumulate in the extremities, resulting in edema of the ankles and feet. Causes. The most common causes of congestive heart failure are coronary artery disease, high blood pressure, long-standing alcohol abuse, disorders of the heart valve, and unknown causes such as after recovery from myocarditis. Symptoms. The symptoms of congestive heart failure vary among individuals according to the particular organ system involved and depending on the degree to which the rest of the body has compensated for the heart muscles weakness. An early symptom of congestive heart failure is fatigue, as the body becomes overloaded with fluid from congestive heart failure. Smelling, edema of the ankle and leg, or abdomen may be noticed.
They make you feel tired or short of breath. If you notice that you're having trouble completing daily tasks like these, you should speak to your doctor. Other people notice swelling, also called edema, in the legs, feet, and abdomen. This congestion occurs because blood flow out of the heart slows, and therefore blood returning to the heart backs up.
Heart failure is typically a chronic or ongoing condition that develops slowly over time. Some patients with heart failure may not have noticeable symptoms. Others may have multiple symptoms, ranging from mild to severe, and these may come or go over time. Some people with heart failure experience fatigue and difficulty completing daily activities. So activities that once seemed easy, like walking the dog, climbing up the stairs, or even carrying a bag of groceries, may make you feel tired or short of breath. If you notice that you're having trouble completing daily tasks like these, you should speak to your doctor. Other people notice swelling, also called edema, in the legs, feet, and abdomen. This congestion occurs because blood flow out of the heart slows, and therefore blood returning to the heart backs up.
Diagnosis. The diagnosis of congestive heart failure is most often a clinical one that is based on knowledge of the patient's previous medical history, a careful physical examination, and tailored laboratory tests. The physical examination is focused on detecting the presence of extra fluid in the body as well as carefully assessing the condition of the heart, pulse, her size, her sounds, and more.
How well your heart responds to activities. A chest X-ray will show the size of your heart and whether there is fluid in your lungs. In heart failure, the heart may be larger than normal. An X-ray can also rule out other conditions that may be causing your symptoms. An electrocardiogram, or ECG, can uncover problems with your heart's rhythm and help your doctor determine whether your heart failure is due to heart rhythm problems or
There is no single test to diagnose heart failure. Your doctor will ask you about your medical history, perform a physical exam, and see whether you have any risk factors for heart failure, such as high blood pressure. In addition, the doctor may order the following: blood tests to determine how your heart and other organs are functioning, including the hormone BNP, which is made by the heart and shows how well it's working. A stress test. You'll walk on a treadmill or pedal on a stationary bike while your doctor assesses how well your heart responds to activity. A chest X-ray will show the size of your heart and whether there is fluid in your lungs. In heart failure, the heart may be larger than normal. An X-ray can also rule out other conditions that may be causing your symptoms. An electrocardiogram, or ECG, can uncover problems with your heart's rhythm and help your doctor determine whether your heart failure is due to heart rhythm problems or
Treatment. The most important and yet most negligent aspect of treatment involves lifestyle modification.
Heart failure means that the heart is not pumping with enough force to adequately move blood along with oxygen and nutrients throughout the body. As a result, the kidneys respond by causing the body to retain fluid and become congested. CHF is caused by many things that damage the heart muscle, such as coronary artery disease, heart defects, diabetes, high blood pressure, obesity, and an irregular heartbeat, to name a few. The board-certified heart specialists at New York Methodist Hospital use the latest technology and procedures to diagnose and treat CHF.
Heart failure, or CHF, affects some 4.6 million Americans, and it is the leading cause of hospitalization in people older than 65. Heart failure means that the heart is not pumping with enough force to adequately move blood, along with oxygen and nutrients, throughout the body. As a result, the kidneys respond by causing the body to retain fluid and become congested. CHF is caused by many things that damage the heart muscle, such as coronary artery disease, heart defects, diabetes, high blood pressure, obesity, and an irregular heartbeat, to name a few. The board-certified heart specialists at New York Methodist Hospital use the latest technology and procedures to diagnose and treat CHF.